talking about that. And then we will also be talking about speech therapy for children with autism, for which my colleague, Ms. Nikita Kirani, she would be joining us. Whatever questions you have about these two therapies, so after I finish my presentation on aquatic therapy, I would take a few questions, any doubts that you have regarding aquatic therapy in autism. And then Nikita will join us, and then once she's completed with her presentation, she will take more questions about speech therapy in autism. So do log in if you have any questions, type it in, and we will answer it at the end of our session. So to start with aquatic therapy for autism, the first thing everybody would want to know is what is aquatic therapy. I'm not going to burden you with the jargon of the technicality and give you the definition of aquatic therapy. To put it very simply, aquatic therapy means to make use of water, make use of the unique environment that water provides, the chemical and physical properties of water, so that we can benefit children with autism. We can improve their symptoms, we can benefit them physiologically on the systemic level as well. So why do we want to do aquatic therapy? There are so many therapies available already for these children. What extra or additional benefit is aquatic therapy going to provide? There are two parts to it. First is the physiological benefit of immersion in water. What does that mean? That when we are immersed in water at different depths, waist level, chest level, neck level, our body experiences certain things. There is change in some chemicals, release of some chemicals in our body, which helps in reducing the symptoms of autism, or which helps in the pathology or the disease-causing processes that are going on in the body of these children with autism. And the second thing is it provides a unique and different environment. We all live on land, and I'm sure many of you might have gone to the swimming pools. Many of you have gone to Aqua Magic and played in the aquatic rides. It makes us feel very good. At the end of the tiring day, when we take bath and come out, it makes us feel relaxed. So water has a very profound effect on us, not just physically, but on the emotional level as well. And the same effect transcends also in children with autism. So we provide them a different environment to explore their bodies, to explore the surroundings. Now as we all know, they have a lot of sensory processing issues. So they are not able to, their brains are not always able to process the touch that they can feel, different textures that they can feel, the sounds that they hear, the visual vision, or what they see. They can't always make sense of that. The lights may be too bright for them. So all of these problems obviously are there on land, and in water we are just giving an alternate environment to see if we can benefit them in certain way. What happens is there is a compression on all the blood vessels of the body. So water is not compressible. When if I move my hand in the air, I don't come to know that the air exists. But if we do a movement in water, it is very difficult because water cannot be compressed. So it has to be pushed away, and that resistance makes it difficult for us to do any movement. So the water is also always compressing on our body, and that helps to push the blood back to your heart. And that increases the what we call as the cardiac output, or the amount of blood that the heart can pump back, because all of the blood is coming back to the heart. This also increases the blood supply to your brain. Now we all know that autism uh, is there is some amount of deficiency in the blood supply and the oxygen supply to the brain. Not all the areas of the brain are functioning as much as they should. There are various studies that have been conducted, or some based on the PET-CT scan, where the metabolism of certain areas of the brain, or the function of certain areas of the brain, is reduced. Now, this can be improved, or this can be enhanced if the blood supply can be enhanced to the brain. Now, because there is more blood that is coming back to the heart, and the heart is able to pump better, the blood supply to the brain also automatically increases. This can help in a lot of cognitive functions, memory, emotions, behavioral aspects of children with autism. The second thing is we have two different types of autonomic nervous systems in the body. So two different responses, of autonomic nervous system. So we have a central nervous system which works, which is like an analytical brain. So it takes time for the central nervous system or the brain to process what we see, what we hear, and then respond to that. So the sensory stimuli that we get and then to respond to that. But there are certain scenarios or certain situations where we need to respond very quickly. Now, in that case, there's something called as an autonomic nervous system that kicks in. For example, if you touch a hot object and you draw your hand quickly, that happens because of a reflex action. These reflexive actions like this are controlled by autonomic systems. Now, there are two types of systems in this, sympathetic nervous system and parasympathetic nervous system. Now, it is thought that in autism, the balance between these two systems is disrupted. So, there is an overactivation of the sympathetic nervous system in autism and depression of the parasympathetic nervous system. But if we immerse a particular individual in the water and if the blood supply is enhanced, then this balance can also be restored just by immersion in water. So we can potentially help in symptoms like hyperactivity, repetitive movements, stereotypical movements that are thought to be caused by this imbalance just by immersing in water.